A midnight deadline tonight for all healthcare workers to get the COVID vaccination.
It's really the clinical enterprise that we're most concerned about. Of course, we don't want to see any resignations related to this, but we know there'll be some.
Rochester's two health systems hoping to minimize resignations, holding special vaccination clinics throughout the weekend and today. Good afternoon. I'm Doug Embledge.
And I'm Jenny Ryan. The state mandate requires anyone who works in a healthcare system or a nursing home be vaccinated or have a religious exemption before they can show up to work tomorrow morning. Rochester Regional says by the end of the day, 99.9% of its employees will have had at least one dose of the COVID vaccine, but did not provide other specifics. URMC says it expects under 300 resignations from employees who work with patients in its hospitals and clinics. The system has delayed some elective surgeries, but there are no plans for additional actions or shutdowns.
We have been carefully managing day to day our census to match our staffing levels. The fact that so many are getting vaccinated certainly is going to make the rest of this week and next week much easier to manage.
Rochester Regional has temporarily shut down 9 labs due to staffing concerns, but did not provide an update to us today.
The number of unvaccinated workers leaving nursing home jobs is going to have an impact on families and their loved ones.
As 13 Lab's Jane Chaco reports, the vaccination rate for nursing home staff has lagged. Jane?
According to state data, there are at least 8 nursing homes in the Finger Lakes region with staff vaccination rates below 70%. As the vaccine mandate takes effect, the termination of unvaccinated workers comes amid existing staffing challenges.
We need these communities to not just survive, we need them to thrive.
Marcella Goheen's husband has been in a nursing home for 5 years. She became an advocate for families with loved ones in nursing homes when she saw the pandemic create more challenges for an already vulnerable population.
We've been living in a disaster for the past 6 months of no staffing, no one to recruit, exhausted nurses, exhausted CNAs.
Nursing home administrators across the country had staffing concerns long before the pandemic. Goheen says the issue will become much worse when unvaccinated employees can no longer work because of the state mandate.
Put yourself in the position of the vulnerable. We have not prioritized the vulnerable in the state.
Saturday, Governor Kathy Hochul announced a plan to address staff shortages. The state is forming a team to identify which areas need the most help.
We're going to find out the resources we have at hand. I've asked some of the hospitals who have those high numbers to give us the names of individuals who are willing to go elsewhere.
According to state data, these are the nursing homes in our area with the lowest vaccination rates. 6 of them are under Hurlbut Care Communities, a major adult care provider. The lowest is at Ladder Road Nursing Home West, where only 56.9% of workers are vaccinated. Hurlbut said no comment when we inquired if they've asked for help once unvaccinated workers are terminated.
These hospitals and nursing homes who've had warning that this is going to happen will be working with us later today and tonight to figure out where people are needed and how we can deploy them in essential areas.
And the governor said that she will be signing an executive order to allow retired healthcare workers and recent graduates to work at facilities who need help.
New this midday, in a last-minute plea, Governor Kathy Hochul urging healthcare workers to get the COVID vaccine.
Can't we just say that that is a basic right that everyone has to know that they'll be safe when they enter a healthcare facility?
Her message comes with just hours left before workers could be terminated if they are not vaccinated. Good afternoon, everyone. Thanks for joining us. I'm Alexis Arnold. Healthcare workers across the state now have just 12 hours before the state mandate becomes official. The governor hopeful those who have waited will now get the vaccine.
We know this has been tough. We know this has been a hard decision, but we really do hope that you'll come around to that decision to help us make sure that we can do everything we can in our power. And that's what I'm using as the full power of the state of New York to ensure that we do everything to protect people.
The governor says the state will be prepared for any staff shortages because of the mandate. That includes deploying members of the National Guard who have medical training. 13 WHAM's Sam Carter joining us from Strong Hospital, where some healthcare workers are faced with a tough choice today. Sam?
That's right, Alexis, and good afternoon. Right here in front of Golisano Children's Hospital, it's been the site of several protests against the possibility of a state mandate about vaccines. But now that the mandate has taken effect, some are worried that we'll have a shortage of healthcare workers. Now, the state mandate is now in effect at any hospital personnel that does not have at least one shot of the vaccine is not welcome at work. The directive is part of the Governor Hochul's plan to try and keep frontline workers safe. But not everyone is so keen on the plan, and that has some concerned healthcare workers. There could be a shortage of healthcare workers. University of Rochester has already suspended elective surgeries for the next 2 weeks, and many nursing home settings are now accepting new patients, with URMC officials saying there are as many as 80 patients waiting for beds. The governor has promised to keep hospital systems to fill hospital system staffing gaps by allowing out-of-state healthcare workers and the recently graduated and retired to fill the posts. One woman we spoke with, who is a former nurse, says this could make a tough staffing situation way, way worse.
I know all the floors are short-staffed because nurses are leaving, and today's the day that a lot of hospitals, you can either get the vaccine or you can't work on the floor, so they're closing floors.
Now, we are expecting more information on hospital staffing later this afternoon, and we are also expecting another protest against the vaccine mandate.
Tomorrow is the deadline. Hospitals and nursing home employees have to have had at least one COVID shot by midnight or risk losing their jobs. At 13 WHAM's Natalie Kutchko has been following this story since the vaccine mandate was announced. Natalie, the big question tonight, what sort of impact is this going to have on staffing?
Well, here at one of the city's vaccine clinics, we caught up with a local doctor from URMC who says the turnout here has been very strong throughout the weekend. Leading into tomorrow, that's when the mandate goes into effect. He also says they've seen more healthcare workers here getting their shots. With just hours before the statewide vaccine mandate takes effect, hospital systems locally and across the state are seeing a critical shortage in healthcare workers. As of September 20th, 99% of staff at Strong Memorial, Highland, and FF Thompson hospitals have been vaccinated. Now, Dr. Stephen Cook of URMC has volunteered at the vaccine clinic held in Rochester's Edgerton R Center for the last several months. He says the staffing shortage has been building up in addition to loss from this state mandate.
And it's not necessarily just an issue right now that the shortage or concern of shortage is looming because of this mandate. A lot of people have dropped out of healthcare over the past 9 months because it's been so stressful. Maybe they were thinking of retiring in a year or two. Maybe they were part-time and want to just stop working for a while. So it's not that the shortage is a manifestation of what's happening right now. It's a manifestation of a system that's been really stretched. A lot of staff being really, really stretched.
Now, some healthcare workers have sued the state over this mandate. And meanwhile, Governor Kathy Hochul has announced she supports it, and she still is doing so. She announced a plan that includes the potential to declare a state of emergency aimed at increasing the workforce for healthcare workers and also in nursing homes as well, if employees follow through with the threat to quit or potentially allow themselves to get fired if they choose not to get vaccinated. For now, reporting live in Rochester, Natalie Kutchko, 13 WHAM News.